Hi, good morning. So I'm gonna do a nasotracheal suctioning. So first and foremost, we always make sure we check the patient's chart, and then once inside, we introduce to the patient and to the other healthcare staff present, and then we always make sure to check the ID band for sure to make sure that we are doing it to the correct patient. So after that, we are going to prepare all the necessary supplies. So we have here the sterile gloves. Make sure it is fully open and it will not be able to touch anything else. This, and then we have here the catheter, nasal catheter, suction catheter, and we have the lubricating jelly. We can either put this one on in this cover of the basin, or we can put it on a clean gauze. And then make sure we have sterile water, and then we have to pour it in the basin with adequate amount so that we can sterilize the catheter before doing it. And then after that, we have to make sure we reassess the patient, obtain vital signs, and then once we're done, we're going to wear this gloving. But before that, when wearing the clean gloves, we have to check the suction bottle and also the regulator. So first thing is we have to turn this one on. Make sure we set it with about negative 120 to negative 150. And then with the bottle, we have to make sure that there are no misconnections, and we are able to check if the connections, there are no kinks on it. So make sure we have to do it. There are no obstructions present. And then set it first. So after that, so while assuming I'm wearing gloving, also while wearing gloving, we can also wear appropriate PPE such as a gown, a face shield, or even for the hair, or even goggles to prevent from splashing of fluids. And then we can also make sure we can obstruct this one to know if what's the appropriate pressure on it, and then we can, before doing it so. And then after that, we have this nasopharyngeal airway. With this nasopharyngeal airway, we will know if its size by measuring it from the earlobe until to the tip of the nose, or some we can also check it with a bevel if it's just too small. And then prior to putting this one, we always make sure we lubricate it with a lubricating jelly to insert it with ease. And then we can have to make sure to check both nostrils if there are any deviated septum, and then we will insert it gently. So by the way, when doing this, when we insert the nasopharyngeal airway, if we sense any resistance, first thing to do is we have to gentle twist it until we are going to put this on that designated area. If we're not able to put it smoothly, well, we can just have to either replace it with a different size, maybe it's just too big or too small, or we can put it on the other nose or nostril. And then we can also do it by checking it if we have a tongue depressor, to check it inside if we put it appropriately. So that's it. So after that, we're gonna hook it with a non-rebreather. Set the flow, and then before putting it, make sure that this bag will fully inflate. So assuming this is fully inflated, we always make sure we hyperoxygenate the patient before doing the suctioning. And then after that, we're going to prepare all the necessary. So we're going to wear the sterile gloves. We have here, we make sure we have our dominant hand, which one is the sterile and which one is the clean one. So assuming this is my sterile technique, so I'm gonna kink it first here. So I'm gonna hold it, my sterile hand, with the catheter. And then we will know it if it's functioning with its sound. There's a hissing sound. We can obstruct it also. And then first is we have to make sure we get adequate amount of sterile water, and then we will know that there will be water coming in this catheter. And then after that, we're going to lubricate it with a lubricating jelly. So once we're done, we will put it to the patient's nose. So remove it and then gently put inside to the patient's nose, and then put it, and then when doing this we should not do it by more